Hello everyone, my name is Dimuthu Rathnayake. I am a PhD student from Centre of Public Health, Queen's University, Belfast. And thank you for having me in this conference HSR UK 2022. This is a piece of health systems and policy research, and my title is Global Evidence to Overcome Longer Waiting Times for Elective Surgery in the Aftermath of COVID-19 Pandemic, a portfolio of systematic review. Waiting times for elective surgeries are a major policy concern in the health systems of many countries that are operated with public funds or tax-financed health systems. Even before the COVID-19 pandemic arrived, long waiting times and long queues for elective surgeries were widely recognized as a major problem, specifically in many high-income countries. Unfortunately, the COVID-19 pandemic put this crisis into another crisis. Due to the massive caseload of COVID-19 infected patients, the scheduled elective surgeries were repeatedly cancelled and repeatedly postponed. A larger number of patients waiting for elective surgery have been affected than ever before and continue to do so with the COVID-19 disruptions. And they have been affected with pain or conditions that significantly impair their quality of life. The long waiting times are more explicit issues in developed health systems even before the pandemic, but an undermined issue in low and middle income countries. The COVID 19 pandemic was at the forefront of minds of policymakers, health service providers, and the public, with substantial resources prioritized to contain the pandemic from its beginning. A large proportions of scheduled surgeries were cancelled or postponed due to the hospital capacity limitations caused by COVID-19 disruptions. According to reports, NHS England has to postpone more than 400,000 elective surgeries to facilitate the COVID-19 response at the first stage of the pandemic. We wrote this review article before the peak of first wave of the pandemic, anticipating the current situation what we are going through now. The consequences could be that mortality and morbidity caused by COVID-19 will be outnumbered many times if adequate attention is not paid to the burden of long waiting lists for the management of non-communicable diseases, cancers, or other conditions. The overall objective of our research was to identify strategies and interventions that might be used to reduce long waiting times for elective surgeries of adult patients and to discuss their effectiveness in the aftermath of COVID-19 pandemic. In other words, the aim of this PhD research is to empirically investigate promising global evidence, and we used systematic review of published literature to achieve this objective. The main outcome variable was defined as waiting time. An initial scoping review revealed a huge body of research, but most of the studies were non-randomized. So both randomized and non-randomized studies were considered for the main review. We registered the research protocol in Prospero database and used RobinSci, AMSTer2, and CASP tools to appraise the quality of included studies based on the design of those studies. To define the inclusion and exclusion criteria for the study participants, we selected only adult patients who had been referred to a surgical clinic for major elective surgery. Patients considered for emergency surgery were excluded, as were pediatric patients. Patients scheduled for cancer or cancer-related surgeries were also not considered. Although most eye surgeries are considered as minor surgeries, patients scheduled for eye surgeries were included as eligible because this is one of the longest surgical lists in many countries. The overall article screening process is shown in Prisma flow diagram. The initial search covered 2014 to 2020 and updated in April 2022. We searched 5 electronic bibliographic databases: PubMed, Embase, Scopus, Web of Science, and Cochrane. Finally, we found 92 articles that were considered as eligible to the review from the overall search. The contents of these studies were highly relevant to the overall research objective, but the full text screening revealed multiple strategic areas and numerous interventions. Considering the relevance of validity of evidence presented for numerous interventions, We identified seven major strategic areas, and these were discussed as individual systematic reviews or sub-reviews as part of this portfolio of systematic reviews. As you can see in this slide, they are referral management, patient prioritization, prevent elective surgery cancellations, perioperative time management, public-private partnership, quality improvement methods, and waiting times targets, and the number of studies are listed in front of them. We had to use meta synthesis for evidence generation because of the heterogeneity of the studies. The first strategy we discussed was the referral management to reduce long waiting times for elective surgery. This review summarizes the research evidence for effective interventions within the scope of primary care referral methods in the surgical care pathway that might shorten waiting times for elective surgeries. On the basis of available evidence, managing referrals by using triage and prioritization of surgical patients is likely to reduce waiting times for elective surgeries by avoiding the overcrowding of surgical clinics with non-surgical referrals. Explicit and standard referral guidelines are more likely to be effective in selecting potential surgical patients if structured referral formats are being used. In addition, using non-clinical information such as patient preferences for scheduling or willingness to switch their surgeon are also recommended as useful. The second strategy we discussed was the patient prioritization. Considering all the quality appraised evidence in the 17 included studies, it suggested that universal prioritization tools with vertical and horizontal equity would help with reordering patients on waiting lists for elective surgery and reduce waiting times. The results revealed that in addition to clinical assessments, incorporating socioeconomic parameters and patient moral considerations into prioritization scoring systems are more effective and more likely to avoid system associated discrimination in certain surgical specialties. Another strategy we discussed was perioperative time management to reduce long waiting times for elective surgery. All activities from perioperative preparation of patient through the operation and up to the post-operative recovery except for the surgery are considered as perioperative period, and efficient perioperative systems improve timeliness of upstream and downstream processes in the surgical care pathway. This review revealed that team-based approaches, proper communication systems, and efficient resource management methods for perioperative processes could minimize the delays of start time of the first case, reduce changeover times of patients, and cancellations of scheduled surgeries in OT lists. Two of the other strategies we discussed are summarized in this slide. The 36 included studies for strategies to preventing elective surgery cancellation revealed that the most surgery cancellations were avoidable or preventable with appropriate preoperative patient preparation, optimum operation theatre supply management, and communication and coordination in scheduling and appointments. The review using public-private partnership to reduce long waiting times for elective surgery suggested that the outsourcing of certain types of elective surgeries to private sector providers may be an effective strategy to shorten waiting times and increasing patients' access to treatment. We could not come to precise conclusions from this systematic review because of the observational studies, but these suggest some useful constructs for future intervention studies. The final two strategies are shown in this slide. Numerous interventions using quality improvement methods have been developed to increase timeliness in healthcare processes. Although positive waiting time based outcomes were reported in the studies, in this review, the certainty of evidence was too low to generalize the results. The considerable variety in patient inputs and resource profiles in health institutions might also be a challenge, and learning through case-based approaches might be necessary to determine the effects of quality improvement applications on waiting times. The use of waiting time target is a demand-side policy and is likely to be effective only if sustained recurrent funds are available along with enforcement such as holding health service providers accountable for the targets. The overall results reveal that the respective policy objectives are no longer achievable and sustainable with waiting time guarantees because of the large shift in external factors such as socio-demographic and macroeconomics. The results in this sub-review indicate an opportunity for a formal policy change in relation to the use of waiting time targets. Summarizing all useful strategies and interventions, the ultimate aim of this research is to support evidence based decision making by policymakers and health administrators. The holistic approach enables the inclusion of a wide variety of research carried out in a variety of disciplines to provide decision support. Considering the overall results of the studies, strategies that can directly reduce outpatient waiting times were more effective at reducing overall waiting times. The impact was determined according to the proportionate durations of time reductions reported in the studies. From the overall evidence, referral management strategies are likely to be highly effective and present a strong association to reducing waiting times with a huge impact. Preventing surgery cancellations and public private partnership for elective surgeries showed a moderate impact in reducing outpatient waiting times. Using waiting time targets as linked to demand side policy are likely to be effective only with sustained recurrent funds along with enforcements. Cancellation of surgeries is now more prevalent than earlier due to pandemic related hospital reasons and patient related factors. Strategies related to scheduled surgery cancellations showed a moderate effect on reducing outpatient waiting times. Compared to other strategies, intervention to prevent scheduled surgery cancellations were more feasible, and the included studies demonstrated several effective, simple, low cost interventions in hospital settings. There was a wide variety of quality improvement methods, but selecting and testing potential productive approaches and grateful refining required profound influence from organization systems. Patient prioritization is a suitable short term strategy to take advantage of immediate individual impact and is an easy and flexible universal application either at local or system wide approaches. Finally, the recommendations derived from the portfolio of systematic reviews are listed in this slide. Considering the current context of the pandemic, there is an urgent need for multifaceted approach to reduce waiting times for elective surgeries. Strategies considered in the 7 clusters of studies in this review were targeted at reducing waiting times at different points in the surgical care pathway and have shown varying impacts on the overall waiting times for patients and populations. Against this background, a combination of short term strategic approaches are likely to be helpful in mitigating the present crisis while moving towards the second line long term operational goals. One off initiatives might often limit the impact in responding to the massive problem of backlogs of patients that we are experiencing now. Standard waiting time measurements are useful in benchmarking and comparison evaluations. It must be realized that the background knowledge implementation sciences is important for successful implementations at organizations, and complexity evaluations are recommended for further empirical and prospective evaluations. Thank you for listening. Please contact us with this email if you have any questions or comments on this presentation. Thank you again.